President.
The senator from Delaware.
Mr. President, are we currently in a quorum call?
We are not.
Mr. President, I appreciate the opportunity to address the body today about the bill we are to take up and debate and advance this evening, and about several different provisions that are of specific concern and interest to me, to the residents of the state of Delaware, and to our nation. Let me just remind all of us, the moment that we are in, there are 26 million Americans who've been infected by COVID-19, a deadly global pandemic. And 445,000 Americans have been killed so far in this pandemic, far too many. In my little home state of Delaware of just 900,000 people, we not too long ago passed 1,000 deaths. And like many other states, we are racing to deliver vaccines and to address the economic and the human wreckage of this pandemic and the recession caused by the bungled mishandling of this pandemic by the now previous administration. I am encouraged because there's also a positive number. 34 million Americans have been vaccinated. Delaware has been at the forefront of delivering vaccines quickly and safely. And now with President Biden and his team at the helm, they are pulling together the resources of our nation, using the Defense Production Act to deliver needed PPE, testing capabilities, and vaccines to every corner of our country. They have a lot of work to do, and they are behind because of some of the failures of the past, but I am excited by the promise of the future. Yesterday, I had the honor of meeting with President Biden in the Oval Office for an hour first thing in the morning, and we talked about this pandemic and his plan, the American Rescue Plan, the $1.9 trillion in badly needed relief that will touch almost every American family and move us quickly out of this pandemic and back towards growth and security, health, and prosperity. And his determination, despite all the back and forth about numbers, his determination at the very core of what we do to keep in mind the middle class of this country, the folks who've been overlooked, underserved, and most disadvantaged. He is passionate about seeing the ways in which this pandemic has revealed the deep inequities in our country and making sure in how we respond to educational needs, to housing needs, to transportation needs, and to healthcare needs, that we combat the profound inequalities of our society and build back better. As Senator Carper and I were sitting with President Biden going over $1,400 checks and this many months of unemployment extension and this much for housing and homelessness or this much for transit, he said, wait. Just remember at the end of the day, keep in your mind's eye a family, a plumber and a teacher with 2 kids at home, one of them laid off, desperately trying to pay their rent, trying to figure out how to pay their bills, trying to figure out how they can keep a roof over their kids' head. And remember the people we are trying to help and serve. I'm reminded of Mark from Newcastle who called my office to tell me he'd been laid off and he was desperately afraid that he was struggling because he was fighting cancer, a health condition, and fighting homelessness, concerned about losing his home. Fighting housing and homelessness, combating homelessness and ensuring security of housing has got to be at the center of how we respond to this crisis. Economist Mark Zandi says there's $57 billion in owed back rent unpaid. And one of the best things we've done as a body is to extend the eviction moratorium that the CDC imposed last year. A key piece of the bill we are taking up and debating is to ensure that more Americans have an opportunity to safe, sanitary, decent, and affordable housing. Before this pandemic, more than 17 million American households spent more than half their money on rent or mortgage, unaffordable to any household. Those 17 million households stretched to their limits. The pandemic has made the risk of eviction or foreclosure greater than ever. Some know my early years were spent working around issues of housing and homelessness. I served with the National Coalition for the Homeless in New York and in 5 other states around the country, staying in homeless shelters in the late 80s when homelessness was an explosion, a crisis across this country that impacted families and communities of all types and backgrounds. People experiencing homelessness are particularly vulnerable to COVID-19. Homeless individuals infected are twice as likely to be hospitalized, 4 times as likely to need critical care, 3 times as likely to die. And in Delaware, on Martin Luther King Day, as part of a service project, I got a chance to visit the Hope Center. The Hope Center used to be known as the Sheraton. It was a hotel in foreclosure, and an innovative county executive used some of the CARES Act money that we provided federally to state and local government to buy it at auction and to reopen it as a source of 192 emergency housing rooms that can have up to 400 people in it. It was great to tour that center on Martin Luther King Day, to be part of those delivering personal items and material for those who are now resident at the Hope Center. But it's just one of many examples of how federal resources we provided last year have been used creatively to help keep people in rental housing, in emergency housing, or in their homes. The CDC federal eviction moratorium was extended in the bill we passed in December, but it runs out in March. Thus, the urgency of our acting. And President Biden's American Rescue Plan includes $30 billion in emergency rental assistance and $5 billion to prevent further outbreaks of COVID-19 amongst America's homeless population. We need to make this a key piece of this provision, an important part of this bill, and it's my hope we can find support on both sides, but if we don't, we must move forward. Let me speak to 2 other topics before I yield the floor, if I might, Mr. President. Those of us on the East Coast, and my colleague from Maryland, my colleague from New Jersey are certainly among them, travel by Amtrak frequently. Before this pandemic, Amtrak carried a record 32 million passengers just 2 years ago. But just like the airlines that when the pandemic hit lost the vast majority of their passengers, so too did Amtrak and commuter rail all over our country. It's been a key piece of our society, our competitiveness, our interconnectedness for over a century, and there are millions who depend on it as their way to commute up and down the East Coast corridor in particular. My office recently heard from Ken Potts, the Delaware representative on the Rail Passengers Association, about the urgent need for funding. And frankly, this is a warning notice for those of you who don't realize that I-95, right as it goes through Wilmington, Delaware, is about to be shut down for most of the next 2 years on a generational repair project. There's going to be 100,000 people deterred off of the highway, hopefully onto rail, but only if it can keep running. There's 1,200 furloughed Amtrak employees, the East Coast and in other places around the country. Those are the folks I interact with on the days when I commute from Wilmington to Washington. I get a chance to talk to the staff, the conductors, the people who work at Union Station or in Wilmington's Joe Biden station. 1,200 furloughed employees and families struggling. Just like the airlines, every bit is deserving of relief, and the budget resolution would allow for the $2 billion over the course of this pandemic that they need. We have provided relief before. We need to provide relief in this bill and going forward. As I mentioned in my opening, Mr. President, getting the vaccine distributed as quickly as possible is the most urgent thing before us. Last Saturday, I had the chance to volunteer for several hours at a vaccination site that Drs. Coker and Hochstein put together at ENT Associates of Delaware. They vaccinated over 150 people, and they had connected to and reached out to some churches that I'm familiar with and fond of, Seeds of Greatness, Bethel AME. But we are under pressure because there are new variants of this virus emerging around the world. What viruses do is they mutate. Some of you know there's new variants from South Africa, from Brazil, from the UK that are more transmissive, potentially more deadly. So one of the things we have to keep an eye on is that we cannot close ourselves off from the world. Something that's missing from a Republican proposal and that is urgently needed that's in the Biden American Rescue Plan is $11 billion to help with global vaccination relief. I recently spoke with Strive Masiwa, a dear friend from Africa who's leading the African Union's plans for how to vaccinate the 54 countries on the continent of Africa. Sure, the Russians have offered their Sputnik vaccine, which was not fully and transparently developed and tested. The Chinese are offering their vaccine. But what I believe the developing world would welcome with open arms, if we would just fund it and provide it, is the rapid scale-up production and manufacturing in countries like South Africa, India, and elsewhere of the tried, true, tested, scientifically sound vaccines made available by Pfizer, by Johnson & Johnson, by Moderna, by the Western companies like AstraZeneca and others that have shown that their vaccines are safe. The United States has long been a leader in world health. We have inspired the world in the way in which we have brought our medical advances, our scientific capability, and our humanitarian commitment to the world. This should be another chapter in that long and brave history. And we must remember that no one in this world is safe from this pandemic until the entire world has been successfully vaccinated. If we do not contribute to the global vaccine campaign of COVAX, if we do not participate in the World Health Organization and in meeting the needs of the developing world, it will simply come back to the people of the United States. Of course, we must prioritize vaccinating our nation, our people, Delawareans. But just as Joe Biden in the Oval Office earlier this week asked me to keep in my mind's eye that family sitting around a kitchen table, worried, struggling with finances, with their health, with their future, we have to keep our eye on the horizon, on having passenger rail available to recover when our country recovers, on having housing and affordable housing options for families who are struggling with homelessness, and our eye on the horizon of the potential threat from the rest of the world of more dangerous variants, which is why we need to contribute to a global campaign to ensure that all of the world's people are safe from this pandemic. Thank you, Mr. President, for the opportunity to speak to these three connected concerns, all of which touch on Delaware's families and our nation, and I yield the floor.